Welcome to our podcast today. My name is Ronald Mkanga, and today I'm hosting Bracelet Initiative Kenya team with me, and I have a very important guest from the team who's going to tell us more about the initiative and also be able to let us know about postpartum issues in Kenya. Welcome, my guest.
Hi, thank you, Ronald. My name is Elma Mishi from the Bracelet Initiative Kenyan edition. Thank you for having me.
Welcome.
Yeah.
It's a pleasure to have you in our show today. So, as we proceed, it will be great for our audience, first of all, to understand the initiative in terms of what is postpartum. We talk about postpartum.
Postpartum is the fourth trimester where a woman goes through immediately after giving birth.
Mm-hmm.
And understanding postpartum by itself, there are so many things that a woman goes through, yeah?
Yeah.
And there's that care, that recovery that a woman goes through. Okay. There's that recovery that a woman needs immediately after birth.
Mm-hmm.
And with this, they might experience emotional, physical, or mental changes.
Yeah, so now I think, Mishi, I think you have really explained well to the audience about the postpartum issue, and I would like a bit just to go a bit deeper in some few questions to be able to relate with the audience about these issues. Mm-hmm. So I have some few questions, probably if you might not have a problem, just to share on a personal level as a mother, what you have gone through. Mm-hmm. And so my first question would be, can you take us back to those first few days after giving birth? What were they like for you emotionally and physically?
Wow.
That's a heavy one.
Yeah, it was a beautiful experience. Exhausting. And there's so much that I went through just to having this bundle of joy. So being a mother myself, it's something that is close to my heart. Yeah, so a woman goes through so many different stages immediately after birth. There's the breastfeeding bit. There are chaps that women have. So it's painful to breastfeed at times. Mm-hmm. And apart from that, if you don't have a good support system, you carry all this on your shoulder. So you can imagine, as a woman with no support, having this bundle of joy, all these body changes, physically, emotionally, and mentally. And that is why, as the Kenyan initiative Bracelet, we felt the need to come in to assist women go through the fourth trimester. Mm-hmm. And by this, it's a sensitization that happens from hospital. There's a bracelet that women get. It's orange in color. I had one, but I recently removed it because I'm past the 6 weeks, yeah? Mm-hmm. So it's a bracelet that can easily be identified by any medic, any personnel that works in the field where women are based, yeah? With the bracelet, it's given from the point in hospital. When the medics are in contact with the patient in hospital, they give you this orange bracelet to identify you as a new mom. The Bracelet Initiative will collect data where we will work with this woman for 6 weeks. And if we see and feel that this woman needs more of us, where we notice that she is going through mental issues, we will continue working with them. Yes.
Good. Good. I think you have really shared very important information to the audience, and I believe I have a question that is actually just came to me in terms of how are you guys dealing with the young mothers? I can imagine the young mothers who maybe not having a partner, so it can be like a double issue, you know.
I would say, especially the young single mothers have so much on their plate. Remember, even if I'm a woman and I have my partner, at least there's this
Support.
ease, this ease of this burden that hana bwana, hana pali usaidizi itatoka, and maybe they're facing rejection.
Yes, that's another one.
From the society. So you can imagine this burden that this woman is carrying. So hapo is where we decided as an initiative to come through, where we have a hotline where this woman can reach us anytime they feel like they want to talk.
Okay.
Yeah. And we assist them through the journey and immediately after by teaching them skills to enable them to fit in back to the society after they have continued raising this kid. Yeah.
Okay. So what you're trying to say is, apart from just also helping them go through the stigma, you also have solutions.
Yes, we do have solutions.
In terms of, like, even I can imagine with the economic situation.
Yeah.
Do you have like a socioeconomic empowerment?
Yes, we do
program
have.
For them?
We have an empowerment program where we teach them skills.
Oh, okay. Good.
Yeah.
Good.
Now there are some who we are taking them through beadwork.
Okay.
We're giving them skills to empower themselves. Where that after you have gotten this child, I will still need to provide for this child.
Yes.
So we will take you through skills that you yourself are able to do. So if you're interested in bakery, if you're interested in mechanical work, whatever that you are interested in and you feel that this will lead me to my next step, is where we empower you and give you the skills to be able to provide for yourself and for your child.
Okay.
Yes.
So that means, yes, because I can imagine most of the young single mothers, some have dropped out of school. So, and there's this kind of like low self-esteem. If you don't have to finish school, there's a lot of like, you can't get a job, you don't have the papers. And so your platform is giving them a chance to get back to society by doing something, despite of whatever they're missing.
Yeah, and okay, like with the case in Marsabit right now, there are so many women who have been shunned from the society. So they hide, and they hide in parks to be able to help each other through this journey. So in the next few years, we are really hoping, and we are really hoping through donors, through the government, and us as an institution to be able to help these women by giving them a safe house or a safe space for them to be able to raise these kids, by us giving them skills and a place for them to be, and immediately after they can go back to the society. So we are thinking of a safe house where these women can feel safe. So
what I'm hearing from you, this is not something you can do by only yourself as an organization, but you might need a lot of partnerships, a lot of collaborations. And if I may ask, probably for now, do you have any local or international partner that is working with you in this journey in terms of even just information, assistance, knowledge sharing, financial support? Maybe you can share.
Okay, it's okay. We are just a month old in Kenya. Currently, it's just the few of us who are funding
Also bootstrapping the whole project from ground up.
Yes.
Okay.
But for training material and all that, we are getting it from the branch in Connecticut.
Yeah.
Yeah.
In the US.
In the US.
Okay.
Yes. And we are really hoping that they will partner with us to be able to help the organization grow and reach out, not in Kenya only, but to the rest of Africa as well.
Yeah, because I can imagine with this kind of information, the goal is to reach out to whoever is going through this, because I believe we'll be sharing a lot of information in the coming weeks about the postpartum issues. So yeah, I think it's a great platform where people can be able to get information.
Yes.
Good. So just as a conclusion, it will be interesting to be able to know the beginning of the year. As we're speaking, this is actually the middle of the month of January, and I believe you guys have a lot of plans for the year. So maybe you can be able just to share a bit of your, what is your vision for this program for this year, and
okay. Our vision for the year is for us to eradicate the maternal deaths, especially in Kenya right now. And beyond that, we are really hoping to reach as many women as we can in different counties, especially the Mandera Marsabit area, because women are going through so much in those areas. And apart from that, we are really hoping to help these women go through postpartum issues all over the country. Yeah, by sensitizing.
Yes.
Wait, by sensitizing. Is it correct?
Yeah, sensitizing and also creating awareness.
And creating awareness in the different counties. Yeah, so we are really hoping to reach over 1 million women by the end of the year.
Wow.
Yeah.
That's a big goal. But of course, if you have good support systems and tools, that's achievable, because it's all about putting structures in places.
Yeah, so we are really also hoping that people will partner with us.
Yes.
Yeah, to be able to help the organization grow and to be able to reach these women from whatever places that they are.
Great. And that's why we're doing this podcast, so that people can reach us.
Yes.
And of course, now, before I give you a parting shot, where can these people who want to reach you find you? Maybe on social handles. Maybe you can share this opportunity to share where they can find you.
We are Bracelet Initiative Kenya on Instagram, on Facebook. We also have our website, which is the Bracelet Initiative Kenya. We are really hoping to venture into TikTok very soon.
Wow.
Yeah.
Wow. Yeah. TikTok is like now the tool for the Gen Zs.
Yeah.
And that's where the mind is going.
And it's also where most of these young mothers are.
Yes.
Yeah.
Yes.
So
yes.
If we can also get the government to partner with us.
Oh yeah, sure.
Yeah.
Sure.
And other organizations out there to reach.
International organizations. Yes. And also multinationals.
Yes.
Even private sector, you never know, because all about support. Because what we are doing is impactful.
Yeah.
It's for the community, and mostly the vulnerable communities.
Yeah.
And that is what is important. Because we believe no one should be left behind.
Very true.
Every human being needs to live.
Yeah.
And live well. So, before we end our show, I would like to give you a bit of give us a parting shot, so that audience can be able to just hear from you.
Mothers need grace, and mothers need us. And without a mother, we all can't be here. So it is important for us to see them through when they go through birth and immediately after. So where we can reach to help them, like a call away, and apart from just that call, you going there to assist them, you holding the baby while they rest, is what these women need. They need your ears. Sit with them, understand them. And if you feel you are around a woman, please ask if there's anything that they need or that they're going through. And apart from that, whenever you notice a woman not okay on the streets and anywhere around you, please try and find out so that they can get the help that they need, and please take them to the nearest hospital. Yeah.
Wow. Thank you so much, Mishi, for that parting shot. And I believe from this show, people will learn a lot about postpartum. People will also be able to reach to you guys and be able to, as you said, you have a hotline, be able to look for support from your platform.
Yeah.
Yes, as we close our podcast for today, I'd like you guys, first we'll be sharing more information about mental health, socioeconomic empowerment, and also just body and physical health that women through postpartum issues go through. So for now, guys, I'd like you to like, subscribe, and share. Thank you so much, and looking forward to see you again in our next podcast. Have a nice time. Adios.